Welcome to the Arizona Early Intervention Program's presentation on the changes to the Individualized Family Service Plan. These changes are the result of new federal requirements for the Individuals with Disabilities Education Act Part C. This webinar is one in a series of presentations created to help Arizona's early intervention community understand and implement the new requirements which became effective July 1, 2012. New items or changes to the IFSP are indicated in red font. It is also recommended that if you make a copy of this PowerPoint, you do so using the Notes page option. This way, you will have a copy of the verbal information as well as the information written on each slide. The new IFSP looks quite different. There are a lot of changes that were made, not only to meet the new regulatory requirements, but to better support teams in their efforts to help families really understand early intervention services. We believe that the changes to the IFSP help support teams implement the 7 key principles of early intervention as they assist families through the assessment process and the development of the IFSP. The Child and Family Assessment process is supported within the IFSP by having the assessment tool become part of the IFSP. There is less duplication of information and thoughtful placement of information so that one page builds on the next as we develop outcomes that are meaningful to the family and focus on the child's participation in routines and activities important to them. As a reminder, the entire IFSP team contributes to the development of the IFSP, even though it is the service coordinator who is ultimately responsible for ensuring the completion of the document. The team should discuss who will facilitate the meeting and who will help write on the pages during the meeting with the family. A complete IFSP from the cover page through the team page is compiled at the initial IFSP meeting and at the annual IFSP meeting. The initial IFSP is reviewed at least every 6 months, and updates are written directly on the initial IFSP through the transition timeline page. Likewise, the annual IFSP is reviewed at least every 6 months, and updates are written directly on the annual IFSP through the transition timeline page. The addendum pages must be used for every 6-month or other review. The addendum pages include the services, payment arrangement, informed consent, and IFSP team page. An other review includes any time that services are changed, such as when decreasing or increasing a service, or when adding a new service. The format of the IFSP has changed from a landscape to a portrait orientation. The cover page now has 3 types of IFSP checkboxes. The additional category is for interim IFSP. An interim IFSP must include parental consent, the name of the service coordinator who will implement the interim IFSP and coordinate with other agencies and persons, and the early intervention services that have been determined to be needed immediately by the child and the child's family. The mission statement has been revised to read, "Early intervention builds upon and provides supports and resources to assist family members and caregivers to enhance children's learning and development through everyday learning opportunities." Next is the Child and Family Information page. In the upper right corner, the service coordinator will write in the IFSP type, interim, initial, or annual, and the date of the IFSP meeting. In completing these fields on the computer, they will auto-populate throughout the document. The child's name and date of birth also auto-populate. In the first section on this page, the service coordinator no longer writes the date of ASIP referral, but does document the date of ASIP eligibility. The rest of this section remains unchanged. The second section, with whom the child resides, has two changes. The service coordinator will ask for the language used by the parent or caregiver to better reflect which language is spoken to the child. Secondly, next to the space for school district of residence, the service coordinator will write the date on which the child turns 2 years, 6 months of age. This is the age in which the transition activities should begin. Under health information, the service coordinator will gather the child's primary care provider's name and phone number and will document results from hearing and vision screenings. Space is allowed for comments and next steps needed for follow-up. The vision and hearing forms are still completed during the initial process and annually. However, they are no longer part of the IFSP. Health plan and insurance ID is no longer on this page. That information is found on the consent for insurance form. Next, space is provided for the child's current health status. Service coordinators should remind families that health history was previously captured and documented in the developmental evaluation. Information in this section should not repeat what is already known, but should bring the information current since the last meeting. This conversation should be guided by the service coordinator for impact on the child's development. IDEA Part C 2011 regulations require each state to use an assessment tool when completing the family assessment. The child and family assessment pages of the IFSP are Arizona's assessment tool. The assessment must be completed and documented on the child and family assessment pages of the IFSP prior to the initial IFSP meeting and may be completed prior to or during the annual IFSP. The child and family assessment pages replace the Family Resources, Priorities, and Concerns page, the Natural Learning Opportunities page, and the Summary of the Child's Present Levels of Development pages of the old IFSP. To assist families in thinking about and preparing for the child and family assessment, the Child and Family Assessment Guide for Families is to be provided to each family prior to the initial and annual assessment. The guide for families may be used by the family to document their thoughts prior to the assessment and as a guide during the assessment. The guide is not collected from families, nor is it required to be included in the child's file. For a detailed explanation of the child and family assessment process, please view the assessment PowerPoint. To summarize, in the initial IFSP process, team members provide the Child and Family Assessment Guide to the family at either the initial visit for children eligible by record review or at the end of the evaluation visit for children needing an evaluation to determine eligibility. Team members must obtain consent for child assessment prior to conducting the assessment, and the assessment is done at a separate visit by 2 team members prior to the initial IFSP visit. In the annual IFSP process, the assessment visit may occur as a separate visit or may be part of the annual IFSP. The assessment must be completed by 2 team members, one of which can be the service coordinator. 1 to 2 weeks prior to the annual assessment, the service coordinator will provide and explain the Child and Family Assessment Guide to the family and ask them which family members would like to participate in the assessment. Also, the service coordinator ensures that consent for the child assessment is obtained. All assessments, initial and annual, include 2 team members meeting with the family and reviewing the purpose and process of assessment. Team members asking the family if they had time to look at or complete the Child and Family Assessment Guide and wish to use it in the discussion. Offering a copy of the guide if the family does not have it, not to complete, but to reference during the discussion. And documenting the discussion on the Child and Family Assessment pages of the IFSP. The assessment tool consists of 4 IFSP pages titled Summary of Child Development Within Routines and Activities. Each page documents the discussion of one activity setting in detail with the family. More pages can be added if the family wishes to discuss more activity settings. A team member may begin the discussion by asking the family what activity area they would like to explore first. This may be an activity that is going especially well or an activity that is concerning to the family. The team member then asks how this activity is going for the various family members involved. The team member then explores the activity, asking who is involved in the activity, what is happening now, and if it is an activity they would like assistance with, what would it look like if it was going well? Follow-up or probing questions can be asked during the discussion to assist the team members' understanding of the nuances specific to that child and family. When completed, the assessment must include sufficient information to ensure that team members have discussed and documented all areas of development, including vision and hearing as appropriate. For example, if vision or hearing impact a child's participation in activities discussed, the team should note that in the description. This is the last page of the Child and Family Assessment Guide for Families and the corresponding IFSP page. The family's naturally occurring resources are discussed and their areas of interest are documented. The team members then help the family prioritize the areas of most importance to them that they wish to address in the next 3 to 6 months. In addition, they document the natural resources that are already available to help them or resources that could be put in place to assist with that specific priority. These priorities will likely be developed into outcomes. During the initial assessment process, the same assessment conversation used to complete these IFSP pages are also used to complete the Child Indicators Entry Summary Form. This form has been shortened to only include the ratings, as the discussion has already been documented in the IFSP. Remember, the forms still must be sent to the AZIP office for data entry and oversight. For the initial IFSP process, and when the assessment is completed at a separate visit prior to the annual IFSP, the IFSP meeting begins by the service coordinator and other team members reviewing the information documented on these pages, paying particular attention to the priorities identified by the family. If the family agrees that these are still their priorities, the team proceeds to developing the outcomes and the rest of the IFSP. If the family has new priorities, the service coordinator adds them to the priorities list, and then the team proceeds to developing outcomes and the rest of the IFSP. When the assessment is completed as part of the annual IFSP meeting, the priority areas are identified and the conversation continues by developing these priorities into outcomes. This is the IFSP outcome page. The team continues the discussion from the priority section from the previous page and documents what is most important to the family. This may be an activity-related priority or an informational need of the family. Next, the outcome statement is developed. The team can flip back to the previous page and review what that activity or routine would look like if it was going well to help them develop this statement. Then, the specific steps that the team and family members will take to reach the outcome are documented. When identifying these specific steps, the team also uses information from the Natural Resources section of the assessment to develop strategies that are unique to this child and family. The outcome status box are used during IFSP reviews. A review date is entered and the progress toward that outcome is described. Based on the discussion, the team checks the box whether to continue, revise, or discontinue the outcome, or checks if the outcome has been completed. You may notice that the What's Happening Now box is no longer on this page. That was fully detailed during the child and family assessment, and if helpful to developing the outcome, can be referred back to. However, it does not need to be duplicated here. After developing all of the outcomes, the team addresses transition with the family. This transition plan page of the IFSP documents the discussion and steps needed to begin to support the transition process. The date the child is 2.8 is important to note, as this is the last day the parent has to opt out of the automatic referral to the parent's district of residence. The opt-out section is no longer in the IFSP, but is on the PEA notification referral form. In general, the date the child is 2.9 is the deadline for the PEA notification referral to be sent to the PEA and the date the transition conference must be held by. If a child's initial IFSP meeting is after 2.9, then the opt-out and the PEA notification deadline are changed to the date of the initial IFSP meeting. For full details on transition, including the timelines, please view the transition PowerPoint on the AZIP website. The service coordinator begins the discussion about transition by documenting any concerns or priorities the family may have regarding transition. In this box, transition may refer to babies coming home from the hospital, transitions into child care, or any other transition a child and family may experience. If the family does not have any priorities or concerns regarding transition, the service coordinator would just document none at this time. Throughout early intervention, there should be continued discussions regarding future placements of the child. During these discussions, the steps needed to support the child and family's transition from early intervention are documented. The service coordinator documents the steps and date these were achieved. This page also documents the parent's decision to hold a transition conference and the parent's consent to share the information with the participants of the transition conference. If a parent agrees to have a transition conference, they can designate who to invite and provide consent to share information. This consent is now directly on the IFSP. If the parent does not wish to have a transition conference, they simply check the box and do not sign this page. This transition timeline page of the IFSP is used to document steps needed during the transition process between 2.6 and 2.9, or as early as 2.3 if all parties agree. In the typical process between 2.6 and 2.9, the steps to be taken to support the child and family's transition from early intervention services to the public schools are documented here. If a child was determined eligible for AZIP after they are 2.9, the transition timeline changes. a transition conference does not need to be held, and the IFSP transition planning meeting is held in conjunction with the initial IFSP. The family must make a decision regarding the opt-out policy at the initial IFSP, and the PEA notification referral form must be sent no later than the next business day after the meeting. The service coordinator will also document when the PEA notification referral form was sent to the PEA and the new requirement when the copy was sent to the Arizona Department of Education. This page also documents when other transition activities occur. These activities include completing the child indicator exit summary form, providing the family survey to the family before or at exit, and offering the family a copy of the child's early intervention records. This page documents the services needed to make progress towards outcomes. Once a team decides which service is needed, the service coordinator will document the service, intensity, frequency, duration, method, and setting of each service. Early intervention service refers to the IDEA Part C service, such as physical therapy, assistive technology, signed and cued language, and nutrition. Please note that feeding is not an IDEA Part C service, but is a specialty within another IDEA service, such as speech therapy. The intensity refers to the number of children being served during a visit, such as individual child, 2 eligible children, or 3 or more eligible children. For example, a team lead may be in a home where there are triplets who are all eligible for ASIP. If the team lead is a physical therapist, is providing services to all of the triplets during that same visit, the intensity would be UP for that service. The frequency is indicated by the number of sessions per week or month and the number of minutes for each session. The service setting documents the location of each service. If a service is being provided in a location other than the home or community, such as a park, the justification section at the bottom of the page must be completed. Services provided in a clinic setting are indicated by the other setting. Method indicates how the service will be provided. For ASIP team-based early intervention providers, team lead is indicated when that service provider is the primary service provider for the family. Joint visits would indicate when another service provider is meeting with the family at the same time as the team lead or other team member. Team conferencing refers to team members who are part of the family's team but may not be visiting the family directly. Non-team lead refers to a service provider who is providing a service to the family but is not the team lead in the team-based early intervention services and is not providing the service through joint visits with the team lead. For children served by DDD or ASDB, non-team lead is the method that will most frequently be entered for all providers. Duration is the documentation of the planned start date and the planned end date. Documentation for the actual start date of a service would be found in progress notes or in other documents, but must always be entered in the ASIP data form within the child's early intervention records. The service coordinator must select the primary service setting, which is the place where the majority of early intervention services are being provided. The Payment Arrangements for Services page captures information about the payer of services. The family would initial that they received information about the Family Cost Participation Policy. The service coordinator would document by checking the boxes that they discuss the use of insurance, public and/or private insurance. If the family has public insurance, such as Access, the service coordinator would check the kind of public insurance box that applies and then list the name of the health plan. If the family has private insurance, the service coordinator would check the private insurance box and list the name of the health plan. Early intervention services would be listed using the full spelling of the service. Next, the discipline of the persons providing the service would be listed. The funding source code number or numbers should be listed. And lastly, the service coordinator would check the box if family cost participation fees do or do not apply for that service. Remember, family cost participation applies to families who have a 0% to pay due to participation in Access, WIC, or for other reasons. Other services in place or identified as needed would be listed. This information may be identified during the assessment process and can be found on the assessment pages of the IFSP. Steps to be taken to ensure that these services are put in place should also be documented. These are services not funded by IDEA Part C, such as respite under Altex. The Informed Consent by Parents for Services page has no significant changes. A minor change was made to box number 2, where the option to circle either to accept or decline the ACIP Procedural Safeguards for Families booklet has been changed to checkboxes. The IFSP team page is not a meeting attendance log, but rather a roster of all the team members involved in the development of the IFSP. The service coordinator is responsible for completing this page, whether the team member is present at the meeting or not. The service coordinator listed would be the service coordinator who will provide ongoing services to the family. If the service coordinator from the initial IPP team was involved in the initial assessment process, they would also be listed on the initial team page as an IFSP team member. The team lead would only be used by the team-based early intervention services team and may be crossed out and replaced with IFSP team member for DDD and ASDB. Other IFSP team members would include the team members who contributed to the development of the IFSP, which for an initial IFSP would include the team members who completed the evaluation and the child and family assessment. For an annual IFSP, the service coordinator would list all team members currently working with the family. All team members present at the IFSP meeting will indicate their presence by initialing the last box in their row. The bottom portion of the page will list the child's core team members not listed in the top section. This section is currently used by the ACIP team-based early intervention services contractors, but in the near future will be used for all service-providing agencies once teams are in place statewide. By listing all team members available to the family, we reinforce the team model in which one person is the primary service provider for the family, but both are supported by the entire team who can be available to them when and if needed. For an initial IFSP, the ongoing service coordinator and one member of the evaluation or assessment team must be present for the entire meeting. Other team members involved in the evaluation or assessment may participate by phone or by making records available prior to the meeting. For an annual IFSP, all team members working with the child and family are required to attend the IFSP meeting with the exception of the team member who conducted the assessment, who would be allowed to participate by phone, by sending a knowledgeable representative, or by making records available. Please submit any questions regarding this PowerPoint to allazip2@azdes.gov. For more information about AZIP, please visit the website at www.azdes.gov/AZIP. Thank you for viewing this PowerPoint.